quick detour before the mouthwash massacre. I was all set to torch the neon blue rinse you gargle every morning, but then I saw something so creepy I slammed the brakes. And you need to see this first. Turns out your gums might be running a microscopic Airbnb for parasites. Not bacteria, parasites. Tiny freeloaders tunneling under your gums like it's a theme park. Look, I know you were promised minty salvation last episode. Don't worry, we'll get to the bottle of lies. But right now, imagine this. Under your gum line, at 400 times magnification, something the size of a grain of sand is crawling around and eating your white blood cells for breakfast. That's Entamoeba gingivalis. It extends little pseudo-arms, grabs your immune cells, and swallows them whole. Meanwhile, Trichomonas tenax, the flagellated swimmer, is whipping its tail and spreading toxic stink like it's the nightclub bouncer of your mouth. If your gums bleed when you floss, congratulations! You may already have guests. You must be out of your mind if you've been sleeping on this and thinking, that's normal aging. No, bleeding gums are a red alert, not a life sentence. Dr. Mark Bonner has been staring at this under a microscope for decades and says, parasites show up in nearly every active periodontal case. Not sometimes, nearly always. Stick with me. I'm going to show you the gross footage, explain how these critters hijack your immune system, and then, yes, it back to the mouthwash expose. But first, prepare to be properly creeped out. Drop a bomb if you're already squirming. So yeah, bleeding gums aren't normal. They're an eviction notice you've been ignoring. And speaking of squatters, let's meet the creeps tunneling in your gums right now. First up, Entamoeba gingivalis. Sounds like the villain in a Marvel spin-off, but it's way grosser. Imagine a blob 1,000 times bigger than a bacterium, stretching out little pseudo-arms, pseudopodia, to grab your white blood cells and swallow them whole. Yep, your bodyguards show up to defend you, and poof, they're dinner. Not a metaphor. I know it sounds insane, but seriously, ask your hygienist about gingival parasites. Watch their face twitch. Then come back and tell me what happened. Then there's Trichomonas tenax. This one swims through your gum tissue with 4 whipping flagella, like it's auditioning for a horror remake of Finding Nemo. Except, instead of singing, it spits out toxins that stink. So, if your breath could knock out a cactus, don't just blame last night's garlic. Blame the parasite rave under your gums. And if you're sitting there thinking, okay, gross, but that's rare, right? Nope. Bonner's microscope work shows these parasites in 100% of diseased mouths, 0 in healthy ones. Translation: if your gums bleed when you floss, congrats, you're running a microscopic Airbnb. And the tenants? They don't pay rent, they eat you. But here's the kicker. They don't just feed on your inflammation, they create it. Then they use that inflammation as fuel to multiply. Yeah. Welcome to the circle of destruction. Imagine squatters trashing your house and then setting the curtains on fire so they can roast marshmallows. That's what oral parasites do. They don't just move in, they weaponize your gums for an all-you-can-eat buffet. Here's the scam. Parasites like Entamoeba gingivalis and Trichomonas tenax thrive on inflammation. The more swollen and bloody your gums get, the better their buffet line. And because freeloaders love efficiency, they don't just wait around. They cause more inflammation to keep the feast rolling. Your immune system rushes in like riot police. White blood cells show up, ready to fight. And the parasites, they eat the cops. Boom, now the riot escalates. More destruction, more swelling, more food. It's the perfect vicious cycle. Your own defenses fueling the enemy. And here's the math that makes hygienists break out in cold sweats. If you've got gingivitis, your risk of parasite colonization skyrockets by 150 times. Let it slip into chronic gum disease? Try 9,000 times higher. That's not bad luck. That's a biological mob takeover. Still think bleeding gums are just aging? Tell that to the parasites converting your jawbone into real estate. They don't stop at nibbling tissue. They burrow, multiply, and invite bacterial gangs to join the rave. And the real nightmare? The damage doesn't stay politely inside your mouth. These microscopic squatters leave the door wide open to your bloodstream. Next stop, arteries, lungs, even your brain. And here's where the conspiracy vibes kick in, because this parasite story isn't new. Dentistry's known about it for nearly 2 centuries, and they've been acting like it's a ghost story. So here's the part that makes this whole thing smell fishier than week-old sushi. These parasites aren't some brand new discovery. Nope, they were spotted under a microscope way back in 1849. Let that sink in, almost 2 centuries ago. Fast forward to 1925, when the American Dental Association literally held training sessions on how to deal with these oral parasites. Yes, the same folks who now hand out glossy brochures about flossing once taught dentists how to fight amoebas and trichomonads. And then, poof, silence. Like the mob suddenly decided to stop talking about the bodies in the basement. By 1981, Dr. Liz Garten published the Smoking Gun Study, Parasites in 100% of gum disease cases, 0% in healthy mouths. Not sometimes, not in a few rare cases, every single time. And yet, go ask your dentist about Entamoeba gingivalis. Watch them blink like you just asked if Bigfoot does their taxes. You tell me, how do we have nearly 175 years of receipts, microscope footage, peer-reviewed studies, and still no mention of this at your 6-month cleaning? Either dentistry has the worst case of collective amnesia in history, or somebody figured out it's more profitable to manage gum disease than to nuke the root cause. I know what you're thinking. Come on, that sounds like tinfoil hat talk. Fine, do this. At your next visit, casually drop the words gingival parasite and watch your hygienist's poker face. Then come back and tell me in the comments how fast the subject got changed. Because if it smells like a cover-up and looks like a cover-up, well, welcome to the dental mafia. Now here's where things stop being horror and start smelling like business as usual. Conventional dentistry doesn't treat gum disease like a parasite invasion. Nope, the standard playbook is scrape the tartar, polish the teeth, schedule your next appointment in 6 months. Rinse, repeat, forever. Sounds fine until you look at the numbers. According to Dr. Mark Bonner's long-term results, conventional deep cleanings only close diseased gum pockets in about 10 to 20% of cases. 10 to 20. That's a coin flip, except the coin is weighted against you. Meanwhile, his parasite-focused approach, using something as basic as 1% hydrogen peroxide, salted baking soda, and rigorous hygiene, reports 95 to 97% success. Not in a lab fantasy, but across over 1,000 patients treated. Think about that for a second. One method turns gum disease into a lifelong management plan. The other wipes it out in months. Which one sounds better for patients? And which one keeps the money flowing for endless cleaning surgeries and implants? Exactly. Now, I'm not saying there's a smoke-filled room where dentists twirl mustaches and plot your gum recession, but I am saying ignorance is profitable. A patient who heals permanently? Not very lucrative. A patient who comes back every 3 months for the rest of their life? That's a revenue stream. Tell me you're not thinking mafia vibes right now. And if you're still convinced this is just conspiracy talk, then buckle up, because the way out of this parasite mess isn't complicated. It's almost insultingly simple. Yeah, I've been dragging you through parasite hell, mafia dentistry, and gum-melting horror. But relax, there's light at the end of this bloody tunnel. And no, it's not another neon mouthwash bottle. Dr. Mark Bonner's parasite protocol is insultingly simple. Dilute hydrogen peroxide to 1%. Mix baking soda with salt. Use it daily. Combine that with flossing. Done right, not the hack it one tooth and quit routine. And suddenly, the parasites don't have squatters' rights anymore. Bonner's data shows this closes gum pockets with 95 to 97% success. Compare that to the pathetic 10 to 20% from conventional deep cleanings. That's not a small upgrade, that's flipping the whole board. But maybe you want extra ammo. Fine, here's the cheat sheet. Chew xylitol gum to starve the worst bugs. Oil pulling with coconut or sesame oil, old school, but it works. Green tea, not just calming, it's basically parasite napalm in a mug. Even rinsing with salt water helps keep the balance in your favor. None of this is expensive, exotic, or complicated. Your pantry and grocery aisle just outperformed a $200 billion industry. And the punchline? Big Dental hates this kind of stuff, because if you can handle parasites at home, you're not a repeat customer. So yeah, hope exists. It's not fancy, but it's real. The only thing it doesn't include, that shiny blue bottle on your sink. Stick around, because that's next on the chopping block. Drop a tooth if your floss suddenly feels more like a lightsaber. So let's zoom out. Parasites in your gums aren't some fringe theory. They've been documented since 1849, trained on by the ADA in 1925, nailed down in peer-reviewed studies in the 80s, and confirmed under microscopes by people like Dr. Mark Bonner for decades. Not occasionally, not maybe. Every single time gum disease is active. Here's the good news. You're not doomed to implants or endless deep cleanings. Parasites can be kicked out. Floss the right way. Hit them with peroxide and baking soda. Stack simple hacks like xylitol gum or green tea, and you tip the balance back in your favor. According to Bonner's data, gum pockets closed in up to 97% of cases. That's not a miracle. That's science with a side of common sense. But here's the bad news. The mainstream still acts like parasites don't exist. So if your gums bleed and your dentist shrugs it off as aging, no. That's your body waving a red flag. You're not crazy for asking questions. You're crazy if you ignore them. And look, I know saying this out loud doesn't make me popular. You don't expose billion-dollar dental routines and walk away with a fruit basket. But I don't care. There's a proverb that says, a truth that's inconvenient is still a truth. So yeah, if my gums were bleeding, I'd rather be inconvenient than ignorant. Now, ready for the real twist? The one thing you thought was helping, that shiny blue mouthwash bottle, doesn't kill parasites, doesn't protect your gums, and might be wrecking your heart in the process. That's our next autopsy. So, if you go down this rabbit hole, well, subscribe before your arteries unsubscribe from you.